Greeting, brethren. Once again, I would like to thank God for this opportunity to come and appear before your presence. I will not be doing justice if I don't thank my parents, Pastor Jolene and Pastor Strike, for the opportunity to present this program, Health Talk. Last week we had a wonderful moment, wonderful time where we introduced this program. And amongst other things that we spoke about, let me take you a little bit backward. I introduced to you to the concept of mental health, what it means and what it is. And we briefly looked at what it means, and we said it's when we talk mental health, it's when we're talking about how one, adapts, into life situations. And, we went further to say, it means how one think, feel, and act when they're confronted with life situations. And when we talked about life situations, we said these are situations that, life will throw at you. And we said there are two ways to go about it. It's either you respond positively, and or alternatively, that will be called adaptive. When you respond negatively, we say that is maladaptive. And we labored on, into three ways or three styles that, globally are said to be the most used as coping mechanisms when it comes to issues of mental health. You remember that I briefly said to you, you're either one, confrontive, that could also be said to be evasive. The opposite will be evasive. And secondly, we said you can either, the second one that is mostly used is, it's supportant, or quite often referred to as self-reliant. And you will remember that the last one that I spoke to you about, I actually spoke about being optimistic, and I labored on that one a great deal, or I went a little bit further. But today I can also say to you that last one that I dealt with, when we said the coping style that could also be used, or which is famous, is called optimistic, but it's also called fatalistic coping style. And I'm not going to go back very much to those. The two that I would want to just to go a little bit in and share a little before I go, I go back to what I promised you last week. It's just to say, when we say the second one, other than your confrontive, it's being supportant or self-reliant as a coping style. What is this? And when we say you are supportant, in your coping mechanism, it means you recognize that you are in trouble, or you have stressors in your life, and you therefore ask for help. You then find someone to talk to. You could join a support group. You could join religious activities, or you can then seek professional help. And those are the most effective way that you could use when you are using the supportant coping style. But opposite to that is what we call self-reliant or self-reliance coping mechanism. And this one is often discouraged for a number of reasons. Because when you are self-reliant, is that you decide that you are not going to ask anybody for anything. You are trying to get strength from within. You keep challenges to yourself or problems to yourself. And the disadvantage with this one is that you don't ask for help. Of course, you think that you have internal strength to deal with it. Challenge is that quite often you only come out to ask for help sometimes when it is too late. People come to know about your challenges when there's very little that can be done to help you out. Sometimes the people come to know that you actually had challenges when sometimes you are hospitalized. So the challenge with self-reliant, which is sometimes it's good, to rely on, what you have, internal strength, consulting books and all of these things. But sometimes, like I've said, the disadvantage is that when all has failed, and your internal strength fail to sustain you, you get help sometimes quite late. Sometimes you cannot be saved. Sometimes you are in deep depression. Sometimes you are in whatever challenge that you are in, you are way deep. So that will be, the advantages thereof. The advantage, like I said, is when you use supportant coping mechanism. You ask for help, you talk to someone else, you talk to your pastors, you talk to, people of influence, people that you think that might help you. And, and you are not limited to that. You can even seek, professional assistance. And the self-reliant, we're saying, it's also well and good. We're not discouraging it. But when you realize that this is way too hard or too difficult for you, don't die don't die within, reach out and ask for help. The last one that I have actually thought it was very interesting that I needed to add to one of the most coping mechanism that people are using lately, and I would not be doing justice if I don't actually talk about it. It is called palliative coping, or what is often called trying to feel better. The interesting part with this one is because it can be done by anybody. You do not necessarily have to consult a professional assistance, or professional help for it. When we talk about palliative coping, what am I talking about here? First, one thing that people do when people that are using palliative coping, first is eating, a healthy diet. 2 is exercising. 3 is, getting adequate sleep. 4 is using journals. 5 is relaxing. 6 is progressive muscle relaxation. 7, it could be meditation. And 8, it could be, your imaginary. And just quickly going back, when we talk about eating healthy diet has a way, of helping one to relieve one's stress or making one feels good. So eating healthy diet can be, in a way, a way that you could use to deal with stressful situation. Secondly, exercising. Exercising, is one way to teach your body to handle stress better. Mind you, that when you exercise, your body releases the endorphins. We all know, I'm sure by now, that endorphins are the natural body painkillers, and you only release them when you exercise, and they help you to cope with life situations. And when we exercising just by exercising alone, for 5 minutes, 10 minutes, sometimes it does not do the trick. The recommended time for one to do exercising is for it to begin to give you, the necessary benefits, to release the natural painkillers like your endorphins, is when you do it for 45 minutes. 45 minutes is actually recommended. Getting adequate sleep is another way of dealing with stress. There is research that is proving it to be correct that when you get adequate sleep, particularly for teenagers, and you when you get enough sleep, it kind of help you to deal with stressful situations. And when you deprive yourself of sleep, what happens is that you sometimes display, depressive symptoms. Let me maybe conclude this, by talking about meditating or meditation, because meditation is also very important. Because meditation is not something that can be done by special people, but it can be done by almost all of us. Excuse me. Meditation can be done by all of us, because meditation has to do with one clearing one's mind. So once in a while, it is important that one could use meditation to clear one's mind. So I thought, in addition to the three that most used coping styles that I shared last week, the palliative is equally important, because it's being used globally and internationally by many people today. People know that it's important to eat healthy diet, it's important to exercise, it's important to get adequate sleep, it's important to relax, it's important to create an environment which kind of relaxes one's mind. And having said all that I've said, I think as we go along, you would begin to gauge for yourself when you're confronted with situations, circumstances that releases stress, whether some of these things that which we shared cannot be used to assist you to cope with life events or events that life throws towards you. Enough of that, and maybe let me ponder to reflect and and go back to my promise last week when we met, that I would share as a way of bringing you on board in terms of how one can use some of these things that I've shared as a way to cope with stressful situation or events. Remember last week I told you, guys, and I thank you very much for your comments. I thank you for your likes, and also thank you for your reviews. I said to you, I will share with you my life story, and my life story have to do with my encounter with COVID-19. How I came to realize that I had the virus in my system, how the journey that I went through or traveled, from the day I was diagnosed, to my isolation or quarantine, to my recovery, and ultimately coming out like I am sharing with you today. Truth be told, like I said to you, I think you would agree, and this is becoming, everybody is agreeing on this one, that when it comes to COVID-19, the virus is not a respecter of person. It doesn't respect you. It doesn't want to know whether you are a doctor. It doesn't want to know whether you are a nurse. It doesn't want to know whether you are a pathologist. Actually, it attacks all of us more or less the same way. In my case, I thought I was safe. I was sanitizing. I was wearing my mask every time I would go out to shops. And I was keeping the social distancing as recommended. Did I keep the virus out of my system through all these ways? Maybe yes, maybe not. What happened to me was that on the day I woke up, I was feeling, one moment I was feeling hot, one moment I was feeling cold. And when I say to you I was feeling hot, I mean I was feeling hot. And when I'm saying to you I was feeling cold, I mean cold to a point of shivering. Cold to the point where you think, this is it. I'm not going to come out of this. When I'm saying I was feeling hot, I mean hot to a boiling point. And, you sweat like you are in a temperature that it's so hot that you were just, dripping water. And a moment later, you move from that planet. You move from where you are feeling so hot to feeling so cold, like you are in Iceland. And I think for me, this wasn't normal. It wasn't something that I'm used to. It was not something that I have encountered before, and I think I will be naive to think that, with all these signs, I was still okay. I think, we reason it with my family that, given what, I'm displaying, maybe it would be best that, I should seek for medical attention. But typical of, we men, I can't speak for other people, but I know we Africans, we don't just want to rush to hospital. Sometimes you want to try this and that. And initially I thought, maybe this is something, it will pass. But then, and I was thinking, what if it doesn't pass? It just takes me with, So the going to consult was the next step. And having said what I've just said, I think this should be an advice to all of us, because I think that, going forward, this virus will be exploding. And as it explodes, and it means most of us are going to catch it. And mind you, it doesn't mean that once you have it and you survive it, it's gone. You're not gonna catch it again. It's if you do not play by the rules, you still do not do what is expected of you, that which you know already, that you cover yourself with a mask, you wear a mask whenever you are going out to public places, you do not sanitize, you do not wash your hands with soap. Chances are you might still get it, even if you had it before. So there I was, my wife drove me to a hospital, and by this time, let me be very honest, I was no longer feeling hot, feeling cold. It's like the temperature, body temperature has gone down. But hey, the headache was so much. And actually, I think this with this virus, there's very little that leaves the virus to imagination, because you remember those signs that we all know, that we've been told about the virus, that sometimes you will have fever. Fever means you are feeling hot, feeling cold, so your body temperature is basically either too high, and sometimes you would have a sore throat, and you would have headache, and all of this thing. Your body will give you all the signs. It's for you, to take hint of the signs, and make sure that you immediately seek for help. Most of us, more particularly we sometimes Africans, we have this tendency that when you have you are attacked with the sickness, sometimes you try this, sometimes you try that, you try so many things. Sometimes you only go to seek for help 4-5 days after the attack. And sometimes by the time you go to seek for help, sometimes it's too late, you can't be saved. But if we can, take hint that, when you feel the symptoms, when you're not feeling good, when you are not feeling, it's seek for help. You're not doing anybody any favor by staying at home, by not consulting, because the only person that you are doing a disservice to is yourself. Excuse me. Now, there I was in a hospital. I met casualty. I'm asked this question and that question, and they immediately, given my description of the symptoms that have prevailed earlier, already I was giving some hints to those that were attending to me that there could be possible trouble here. I was admitted overnight, so that they could deal with, my temperature, which was going down, going up. I was admitted that they could deal with my headache, and that was pounding so hard, I could hardly stand. And I was admitted because they were saying to me, it is best that we don't just treat the symptoms of your temperature, which was going up and down, not only to treat you for headache, but we should also wait in the morning that tests are taken for your COVID-19, so that we could be sure that you are clear in that regard. So the following day, the tests were conducted, and the results was to be made available the following day. So this is now my second day in hospital when the tests are taken, and I'm waiting for the third day where the results would then be communicated back. While in the hospital, I think through the treatment that I got, my temperature became normal. My headache was addressed. My head was no longer pounding. I was feeling okay. Everything appeared to be back to normal. The third day, the day after the tests were conducted, the results came back. And guess what? The doctor stood before me to communicate the results. And he says, "I have to inform you, sir, that your results are back and you tested positive for COVID-19. And my world, I'm sure, came crumbling down. And I just stopped thinking, stopped reasoning, stopped, like you're saying, positive. Sometimes, watching TV a lot sometimes is good, sometimes doesn't help, hey? When you are told you're positive, remember I just told you a moment ago that I was treated for my temperature, it was normal. It was taken that morning, it was 36.1, it says I was good. I had no headache, no sore throat, everything was fine. But then the results come. The results says I'm positive. I forgot that I was fine. And all I could think of, it's all those people that I've seen, being rushed to ICU in ambulances. All I could see is, I think to wrap it, all I could see was my funeral. I said, this is it. I'm history. I'm gone. And, you could only think of the legacy, things you have left behind and everything else. So this is me up to the point of my results coming back, being declared positive. The simple fact that I'm talking to you today testify to one thing. I did not die. I'm still standing. And time permitting, I think, it will be important to share with you, my journey now. Now I have the diagnosis. It's in black and white. The results are positive. And I did not die. What happened from that day going forward? I think it should be very interesting, because those things that I shared with you, the two types, the two ways to deal with stressful events, positively, in a positive way, adaptive, maladaptive, now come to play. And I think going forward, begin to see how all of these things that I prepared you, or I laid as a foundation, the coping styles, the coping mechanisms comes to play. But that is a topic for another day. My friends, let me take time to thank you again for your comments, for your likes, for your reviews. And in our next episode, we would have, a doctor, a medical doctor who works with children, and in the name of Dr. Hlekani Mukiti. She's a pediatrician, and she should be talking to us about issues that relates to the young ones. But hey, me and you are not finished. Our story continues. We'll just take a break, give you time to recover, and in our next, in our future episode, then I will take you through on how I went about, how I coped, with the situation that I was confronted with, the support, where I got the support from, who supported me, who stood by me. Because truth be told, when you are confronted with something like this, sometimes self-reliance, relying on internal strength sometimes is not enough. Till next time, stay safe, stay blessed. I thank you.